all concerned about our good health, and certainly part of good health is good dental health. We're talking today with Dr. Leif Loberg, local dentist. And Dr. Loberg, good to have you with us on the program.
Thank you.
You've been doing this for a number of years, and you provide all the normal dental services that we're all used to, teeth cleaning and all those things. But you've got a procedure that you're working with now that's rather unique and rather special.
It's a procedure very, very new to the market. It's a procedure called the All-On-4, which basically utilizes 4 implants that are placed into the jawbone, on which a full set of teeth on one arch are attached.
I know we've heard about implants for years, and we've seen the individual teeth being replaced. This is the next step in that procedure, so to speak?
Yes, it is. It's really a procedure that's been designed to treat patients with what we call a terminal dentition. And a terminal dentition really is a situation where patients are, in the very near future, about to lose all of their teeth. Mm-hmm. And so by removing the teeth, by immediately placing the implants in place for them and attaching a brand new set of teeth, we're able to restore those patients to a perfect bite.
I know there are places in this country, so-called denture mills, and they provide generic dentures for people. This is not what we're talking about. This is a unique process and a very specialized product.
This is an extremely specialized product. We actually have a very, very special privilege to work with a world-class technician, Momo Vasilich, who has invented the actual maneuver that goes alongside with it, called the Mo2 maneuver. And that is really the blueprint and the roadmap to being able to predictably deliver a patient a perfect bite and a perfect smile every time.
I know that's been one of the problems people in the past that have had their teeth replaced. The bite is off, they can't chew, they can't eat certain foods. This solves many of those problems, I understand.
A lot of times when patients lose teeth, especially in the back molar area, it becomes very, very difficult to chew. A lot of times patients begin to use their front teeth, and it becomes increasingly more difficult to chew and swallow their food. And what happens is patients start to swallow whole pieces of food,
which can cause choking and other problems and digestive problems as well. I know in many cases it also maybe limits their diet, and sometimes they have health-related issues with a poor diet because of their teeth.
Exactly. And when a patient can't chew and enjoy their food, a lot of times a lot of other things go downhill as well. And one of those things is general health. Mm-hmm.
Well, you know, it's one thing for you and I to talk about this, and you've done this procedure numerous times and you're an expert in it. But I think it would be interesting for our viewers to hear from some of your patients, some of the stories they have to share about how this procedure has helped them.
Absolutely. I'd like to introduce Tony, our first patient, and just a phenomenal example of a patient that was really searching for an answer. His dental condition involved a lot of pain associated with not only the teeth, but also the gums. Pain where he couldn't chew, pain where it was really uncomfortable. And what we were able to provide for him, utilizing the Mo2 maneuver and the All-On-4 implant procedure, was really a perfect bite and a perfect set of teeth that he today has no pain.
There was pain. It was I couldn't eat. I had to be real selective on what I was eating, and I had constant pain. I called up and made an appointment that day. I went down there. That's how bad I was hurting. That day, I went down there. Yeah, I got in an accident. I lost my front 2 teeth, and then I had bridges on those, and those bridges were falling apart. I just had really bad gum pains and stuff. I don't have any gum pains anymore. I don't have any at all. I don't know exactly what you did, but it went away.
Every dentist that you'd gone to told you it wasn't possible.
Right, they did. They told me they had their alternative plans that they had were not anywhere near what you had. They were fix this a little bit here, fix this a little bit there. It was kind of a little bit at a time, not really solving any of my problems. After a couple of $1,000s and really not getting anywhere that I was going, I moved down here. Not because of you, but I moved out here. I didn't even know you then. You're the one who came to me actually said, you know, you've got some serious problems here. Would you like some options on what you can do? I can show you some. And you did, and we got involved in it right away. What was it, a couple of weeks? And I did some preliminary stuff, and that was it. You took out all my teeth, on the bottoms first. He did my bottoms first. He took out all my teeth and then put this back in on the same day. This is exactly what I had when I left the same day that I went in. I was in pain all the time. I couldn't eat very well. It just hurt all the time. I'm always like this, you know.
Okay, so tell me, Tony.
Was not happy. Now I'm happy. I can crack all kinds of jokes now. Before I couldn't.
As you can see with Tony, he basically came to our office in pain on the bottom jaw, and of course then with his current dental condition, missing several teeth due to an accident. And when patients lose their molars, it becomes almost impossible to chew and eat. So utilizing the Mo2 maneuver and the All-On-4, both the top and the bottom jaw were restored to a perfect bite. And in Tony's words, which I'm quite confident that he'll say, his confidence has been restored. He's a happy guy. He laughs all the time. He's not embarrassed. He's not embarrassed to meet anybody new. It's a life changer.
And he kind of shared with us it's improved his social life as well.
Yes, absolutely.
Which, no guarantees, but that's a side effect that he enjoys from all of that. Well, I know one of the things you pride yourself on in your entire dental practice is dealing with each patient as an individual. And sometimes patients come to you with special needs. Could be fear. I know we all grew up maybe being afraid of the dentist. Remember the old Westerns, 2 shots of whiskey and they start drilling. But you deal with all kinds of special needs in your practice.
We do. And our next patient was a particular special needs patient, lost all of their teeth on their bottom jaw. And so they were unable to eat and chew. And because of the physical handicap, these particular patients are absolutely unable to tolerate a full denture or a plate. And so you either live life with bare gums and no teeth, or you've got to do something different and come up with a different solution. It's really, really a life changer for these patients because not only are they special needs, but when you restore them and give them back their ability to eat and chew, all of a sudden they forget about a lot of other handicaps dentally.
Yeah.
This is a fantastic example of being able to restore using the All-On-4 procedure on the bottom jaw, being able to restore a patient back to eating their normal diet, including pizza, hot dogs, crusty Italian bread, everything they dream.
And in this case, actually better than she ever was her entire life.
Yes, that's absolutely true. A lot of times special needs patients are also born genetically with the absence of a good majority of their teeth. So they're never given that chance even in the first place.
When she was born, the only trouble from the very beginning when teeth came out was always bad. Everything else was okay, but not her mind, but everything was physically okay except the teeth. As she got her first teeth, they came out so badly in such a shape you wouldn't even imagine it, and what this way and that way, and it just was terrible to look at. So we got dentures, and she got the denture, and she puts it in, and when they were gone all the time. Underneath the mattress here and there, she wasn't going to do it, and she says, no, I can't do it. And then Dr. Loberg showed me how it worked, and it looked so simple. She had a meal right off the bat. Not hot dogs and not pizzas, but a meal. And it was fabulous. And we right away got on Skype at night and showed everybody from far away her teeth.
And you showed your sister in Germany?
Oh, yes.
And you guys are both crying.
Yes, right. And it was just so unbelievable that it was from morning to a little bit after lunch. We had everything. I can send her to camp, and I'm not worried about it. And she goes to daycare now, and I'm not worried about what she eats, and she can eat whatever she wants to. And also cleaning is easy, because after all, she's not like us, so it's hard to get her to hold still or do anything. No, it's much simpler. So yeah, that really changed our lives.
So one of the chief complaints that a lot of patients come in with really is their fear and phobia of pain, and that's a big one. I mean, dentistry in the past has been all about that, from the Marathon Man to all the terrible movies.
Yes.
It's really given dentistry a bad stigma, and so that fear of pain is ingrained into a lot of patients' minds. With this procedure, where we literally take out someone's teeth, we put 4 implants into the jawbone and attach permanently a set of teeth that don't move around, that don't press on the gum line anywhere, that don't slip around like a loose shoe on a foot. And as you can see from Ron and his story, the pain after the procedure is very, very, very minimal. It's a small amount of discomfort from typically where we have to anesthetize the patient. Yeah. Because obviously you can't do the surgery without it, but it's awesome. Traditionally, where we had to take teeth out of a patient and deliver a full denture,
Right.
there was a huge adjustment period and a lot of adjustments on the patient's point of view to get rid of the sore spots.
Yeah.
This procedure has none of that.
The only pain that I really had was just discomfort, only from being numb. I mean, I was told nothing like this could be done, and I've gone to probably 10 different dentists, and they all said you can't do anything that's permanent. It's always going to be a snap-in partial denture or snap-in full denture, but never was I told that you could do anything that would be screwed into my head and not come back out.
And how does that make you feel? The fact that
Like I got a third set of teeth. You know, I passed my baby and adult teeth, I got another set, and that's what I feel, that it, you know, whether they grew in there or not, they're permanent now. And that's something I just thought was gone forever.
For years, I heard people complain about every procedure and product they tried to make that problem go away and had their dentures refitted. I understand you folks don't even like the word denture. It really is an old word compared to this new procedure that you're doing.
That's exactly right. Momo Vasilich are the inventor of the Mo2 maneuver that's used in conjunction with the All-On-4, has essentially pioneered a technique to eliminate any stigma associated with a denture. He's an artist. He's a world-class technician. We're extremely fortunate to be able to work right alongside with him. And the prostheses that he makes are literally custom sculptures for every patient, every smile. A few words that Momo, I think, would agree with are that what he creates for a patient is the patient's inward natural beauty. And that's his real goal, is to try and restore that.
I was able to kind of streamline or create a protocol or methodology that would help any clinician stay on the path during this procedure. Normal people placing 4 implants, what you are doing, and treating basically a patient with a terminal dentition sounds rather simple, okay? But what I used to say, it's extremely delicate procedure, I would say, And again, being able to see all those surgeons and clinicians and colleagues like you around the world, I have realized I was able to detect and identify every single point, what's the weakness, what's the important or less important thing in this protocol. And bringing this, what we call now most square maneuver, to work, allow us, I think, to basically have success on every single surgery when we restore the patients with a terminal dentition. Extracting all these teeth, optimizing the level of the bone, placing those implants, the screws, in a good trajectory, so they fit nicely with the prosthesis that you're going to provide, and then providing the prosthesis, assembling all those things together. But instead of 8 months or 1 year, as you would do when you go to your neighborhood dentist, Dr. Loberg will accomplish this in one single visit. And it's incredibly fantastic, actually.
It was interesting talking to Momo over lunch. He's been all over the world and worked with surgeons all over the world that have done this procedure, and he gives you high praise for having, as he puts it, the golden fingers.
He does. He jokes around about that. But The procedure, the All-On-4, is very, very, very technique sensitive and a very delicate procedure in itself. There are so many turns where the procedure can either go really, really well or awry. And predictably, with both myself doing the surgery and with Momo doing the prosthetics, it's been a perfect union.
One of the things I think that's interesting about your practice and specifically this procedure is you're dealing with people at all types of ages with all kinds of health issues. I believe you had a couple come in a few months ago with an interesting concern that they had.
You know, a lot of people ask, you know, Doc, am I too old to do implants? I'm too old, I'm not going to heal properly. And so really you have to make a choice in life at that point as to the direction that you want to take. You either go along the path that you're currently going and live with miserable, ill-fitting dentures or worn down, broken, decayed teeth, or you can make that choice. And for the better, take out the teeth, do an All-On-4 procedure, put the implants in and restore the teeth immediately. And I think our next patient here, Bob, really, really, really is a true testament to exactly that road in life that he was on and where for the last 10 or 15 years being really unable to smile at anybody, to be tight-lipped in photographs, to be embarrassed to talk to people, to cover their mouth with their hands. We treated Bob with both an upper and a lower jaw All-On-4 procedure, really customized it so that he has a perfect bite, and I think his better half has a lot to say in terms of how he feels.
My teeth were in kind of very bad shape, and I had a bridge on the left side. When I'd carry on a conversation, occasionally the bridge would come out, and that was very embarrassing to put it back in and continue on with the conversation. I had lost confidence in myself. I would not smile. Any picture you see me was tight-lipped.
Actually, Bob, you know, he's got a great sense of humour, but unfortunately, his teeth were so bad that he wouldn't laugh. He would put his hands up over his mouth, and it was a shame.
Then when I looked and saw your advertisement on the TV with a hockey player and being Canadian and going to a good college, I elected to visit your office. When I asked you what my alternatives were, you brought me out a couple of models. And the one that had the 4 or more implants on the uppers and lowers, I knew immediately that that's what I wanted. And I looked at some of the pictures of the patients who were in the same condition my teeth were, and immediately I knew it was the choice was to go with that procedure. Well, I haven't restricted myself from anything, and as Christine will tell you, I'll eat the spectrum of foods, and I have here lately, and I have no problem with corn on the cob or any of the foods that you normally would have with dentures or plates or what have you. But I had a big bite of a pizza last night, including the crust. I've been into some of the best steaks here in California. So we were out to dinner at a local Mexican restaurant, and our friends from Australia who were visiting took a picture, and I forwarded it to Dr. Loberg on the internet. And anyway, it was I had my full smile, and I have to admit, when I saw the picture, I thought I was kind of a handsome dude.
Well, they look like a very happy couple, obviously happy with the results.
Absolutely. And I think Bob's better half said it best. He's a happy guy. Yeah. He loves to laugh. And he no longer has any hesitation about smiling.
Yeah. Well, you get all kinds of ages, all kinds of types of people. The next one, I believe, is a lady who also had some unique challenges that she brought to you.
Yes, this was a very, very unique case, actually. There's normally a stigma that Mexico was a cheap place to go for cheap dentistry.
Right.
And this next case is of particular interest because this patient is actually from Oaxaca, the southern part of Mexico. A very, very, very sad story behind this particular patient who suffered a number of years from physical and domestic violence and lost her teeth as a result.
Ok, quiero que usted me diga cómo ha cambiado su vida ahorita que usted tuvo este procedimiento que le hizo Dr. Loberg. Okay. ¿Cómo cambió su aspecto a cómo se mira usted hoy en el espejo a cómo se miraba antes?
Pues es mucho, porque antes era muy difícil la situación, ¿no? Pero ahorita con este procedimiento bastante bien.
Ok. ¿Cómo le ha cambiado su aspecto, ya sea físicamente, emocionalmente y obviamente cuando uno socializa con la demás gente?
Pues emocionalmente en mucho, porque pues antes era muy difícil pues hablar, reírme, ¿no? Pero ahora es muy diferente con este procedimiento, me siento feliz porque no lo esperaba que fuera una cosa tan grandiosa para mí.
Claro. ¿Y socialmente cómo le ha cambiado su vida?
Pues bastante, porque pues ahora me puedo reír, hablar con mucha confianza, que antes no lo podía hacer, pero ahora sí, me siento bien.
Qué bueno. Ahora, cuando el doctor, yo sé que usted vino de Oaxaca a hacerse el procedimiento con el doctor Loberg.
Sí.
¿Usted una vez se imaginó poder tener una sonrisa así como la tiene ahorita en solo un día?
No, nunca imaginé. Nunca imaginé que todo este procedimiento sucediera en un solo día. Y más al salir así con los dientes, pues de un día luego.
Claro.
No, fue una cosa grandiosa para mí que no, ni en México no creo que exista, menos en mi estado, menos de donde yo vengo, no creo que esto llegue por ahorita o por el momento, quizá más adelante.
Claro. Ahora dígame nomás un poquito de cómo perdió sus dientes.
Pues es una situación muy difícil y muy triste, la cual no quiero recordar. Pero ahorita me siento emocionalmente feliz con esto.
Muy bien.
Muy bien, feliz y gracias al doctor Loberg y a su inteligencia.
Okay.
¿No? Perfecto, bonito.
Another interesting story.
Just fantastic. And as you can see, a patient that flew all the way from the south of Mexico to have a procedure done in Southern California. Quite the opposite of what you'd think. But really, yeah, we've been able to really restore her life back to beauty.
Yeah. She was on with a member of your staff, Julie.
Julie, who's our team leader in our office, and she really runs a beautiful ship. A lot of patients, in fact, most of our patients love and really enjoy coming to our office, and really that's what we strive to achieve in our dental office. An environment of non-judgmental environment of caring and providing really, really, really professional, top, unparalleled care.
You guys, well, that was the one thing I was embarrassed about, the condition of my dentures, and you guys made me feel fine with that. We've seen plenty of bad things. Don't even let it bother you, and that helped too. But I just the whole treatment just from walking in the front door, I haven't had any fear of anything, just because of the way everything is. Your staff is great, pretty too, and I couldn't have asked for a better experience in dental.
You have a beautiful office, really high tech. That's what I like. It gives you a little more self-assured when you go into an office that has got all the equipment that you have, rather than going to one that's a little on the shady side.
I couldn't believe it when you showed it to me. It looked like, God, can it really be done? Can it really? But he made it so clear, and I would recommend it to anybody, especially children like that.
One thing I like about Dr. Loberg, we get along pretty well, and we're laughing. The other day we were laughing, and one of his assistant dentists came in, and he had to see what all the fun was. He thought he was missing out. The whole point being, it's an enjoyable experience, and I'd highly recommend him as your dentist if you're considering this procedure.
Right now, we are really performing some landmark surgeries on a daily and a weekly basis in something that you have actually invented and really set the pioneering tracks to treating what we call a terminal dentition. And a terminal dentition is really what I would define as someone who has a limited lifespan on the remaining teeth, where they will all need to be extracted. And you have actually invented a way to systematically predict and deliver not only a perfect set of teeth, but a perfect bite, time in and time out.
First of all, thank you. I mean, it sounds, I want to keep this as humble as possible. Without good fingers and golden fingers of a dentist in this situation, this methodology, if I may call, would definitely still not work as well. Again, I am so happy that I have found him at the end after all these years, because I guess this teamwork works just impeccably, and every single patient we are bringing out basically drops one tear on the left or on the right, and that's the best, the best signal for me that we are doing something good. Huh?
Absolutely. There's, as far as my dental studies and everything that I have ever studied, there is nothing in dentistry that is more transforming. You can't honestly wake up in the morning and cut 10 crowns or do 5 fillings or a couple of cleanings and actually say and declare that you've changed someone's life. But every one of these procedures that we've ever done has changed someone's life.
Literally changed, yeah, exactly.
What's the maintenance like on this product? Is it different from, say, regular old dentures or other type of teeth?
What we recommend minimally is that patients return once a year for a regular checkup and a cleaning. The maintenance is just wonderful.
You brush your teeth like normally?
You can, absolutely. What we recommend is a water pick. It's very, very easy to clean and keep everything in a great maintained state. You're saying there's possibly some tax benefits by getting this procedure taken care of? Yes. Believe it or not, the All-On-4 procedure, depending on your age and your situation, can be up to a full 100% tax deduction. Interesting. So obviously talk to your office and talk to their accountant and their CPAs and get more information on that. Absolutely. Dr. Loberg, thank you so much for sharing with us some good information, and we thank your patients for sharing their time with us as well, giving us some good information on how this procedure has helped them to enjoy their lives more. We want to thank you folks for joining us as well. If you want to find out more information, check with Dr. Loberg's office. They can give you more specifics on how this might be helpful for you.